Two, one. You are now live.
All right, and we are live. Hey, hello everybody. Dr. Alex Earle here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earle. And of course, it's the time I get to spend with you guys, answering all your plastic surgery questions and going over some plastic surgery topics. And today, I thought I would kick it back a little bit old school. It's been a while since we've done like the comprehensive review of. So today, I'm gonna kind of start off a new series. So today, we're gonna start with a comprehensive review of Mommy Makeover. Next week, I'll probably do the comprehensive review of BBL and such and so forth. We'll go into like liposuction and tummy tuck, and pretty much try to give you as much information about these procedures as possible. And then, of course, I'll be happy to answer all your questions as well. All right, so yes, let's dive right into it. Because today it's a little bit of a longer topic because a mommy makeover is actually a combination of two surgeries, right? So essentially we're talking about everything that has to do with the breast surgery and everything that has to do with your tummy tuck. So let's start with the definition. So we call it mommy makeover. That's kind of like the common name right now. And what does that exactly mean? It means that we're combining a breast surgery with a tummy tuck. Okay, that is your most common definition of a mommy makeover. And certainly here at Pure Plastic Surgery, when we talk about the mommy makeover, that's what we're referring to, okay? So you can have any sort of breast surgery plus your tummy tuck. That combined is your mommy makeover. And if you add, you can actually potentially add the arms, so arm lift or brachioplasty, and that's what we call the trifecta perfecta, okay? Because that would be 3 procedures in one, and your mommy makeover is 2 procedures in one. So people typically ask them, well, in terms of the breast, what breast procedure are you talking about? And it's just any breast procedure. So it can be just simply a breast augmentation. It could be a breast lift plus implant, or a breast reduction. Okay, so it can be any breast procedure combined with the tummy tuck. All right. Now, as with all procedures, of course, the first thing we got to think about is pre-op. What are some of the things that we have to do before surgery in order to prepare? Okay, so we want to make sure that, first of all, before we get into the pre-op itself, that we have the right candidate. Who is the right candidate for the mommy makeover? Is it only mommies? Well, no. Obviously, the answer is no. It can be anyone that has, wants to basically improve the look of their breast and it has excess or loose breast skin, abdominal skin, and potentially some muscle separation or muscle weakness. So it's typically for patients that are, after 1 or multiple pregnancies, or for patients that have had massive weight loss. Okay, those are the patients that qualify, but you have to be healthy, right? You can't be having multiple medical problems. If you have some medical problems, they have to be controlled. So a lot of questions, a lot of times get, well, if I have high blood pressure, can I do a mommy makeover? And the answer is yes, as long as it's controlled. So certain things like diabetes, high blood pressure, hyperthyroidism, those are okay as long as we get the clearance from your primary care doctor and everything is under control. All right. What we absolutely don't do, are smokers. No tobacco. So if you smoke or somehow take in nicotine in any way, shape, or form, whether it's a nicotine gum or a patch or actually smoking, you're not going to be getting your mommy makeover. You have to stop all nicotine at least from 30 days before surgery to 30 days after surgery, okay? The other thing you want to make sure is that you're not on any stimulants such as phentermine. For phentermine, you got to stop that from 30 days before surgery to 30 days after surgery as well. And last but not least, but common nowadays, are the semaglutides or the other like similar medications that are taken for weight loss. So if you're on Ozempic or semaglutide or Mounjaro, we were going to want you to stop that ideally 3 weeks before surgery, but at the very least 2 weeks before surgery, okay? Because the way that these medications work is that they slow gastric emptying, and we're going to make sure that stomach is empty before undergoing general anesthesia, okay? So keep that in mind. If you're on semaglutide, Ozempic, Mounjaro, you got to stop it ideally 3 weeks before surgery, but certainly at the very least 2 weeks before surgery, okay? We're also going to check your labs. So we're going to check your CBC, which is basically your hemo level and your white blood cell count, plus some other markers there. We're going to check your CMP, which is your complete metabolic profile, which is all your electrolytes, right? Your for example, your sodium, your potassium, your chloride, etc. Okay, so we're gonna check all the electrolytes there. We're gonna be checking your EKG, make sure the heart is healthy, and that we do for everybody. I know some patients are like, wait, I'm 20 years old, I'm super healthy. Doesn't matter, we're gonna check your EKG, we're gonna make sure everything checks out before surgery. And then we also ask for a medical clearance from 100% of our patients as well. Again, no matter how healthy you are, we still are going to require that medical clearance. Okay, so labs, EKG, medical clearance are required of all patients. Okay, now how about the mammogram? Well, that's going to be only for patients that are 40 years old or older. Okay, so 40 years old or above, then we will ask for your mammogram. Okay, the only time we'll ask for a mammogram if you're younger than that is if you've already had some sort of history of breast cancer or some sort of breast issue that that we already know about. Okay, but typically for most patients, 40 years old or older, that's when we're going to ask for your mammogram. If you're younger than that, we're not going to ask for it. Okay, all right. Once again, no tobacco, super important. If you show up to surgery day and we are going to test your urine, we're going to test it for all sorts of drugs, and we're also going to test it for nicotine. If it's positive for nicotine, your surgery will get canceled, and then you're going to have to pay a penalty. No bueno. Don't do that. Okay? All right. All right. The other thing to keep in mind is for the moms, the young moms out there, okay? It's not ideal to do any sort of breast procedure until at least 6 months after you stop breastfeeding, okay? So it's not 6 months after giving birth, it's 6 months after you stop breastfeeding, all right? Why? Because we want all those milk ducts to be fully closed before we undergo surgery, okay? Milk ducts that are open lead to higher incidence of capsular contracture and infection when we do breast surgery, okay? That's why we want to wait at least 6 months since you stop breastfeeding to give your body enough time to kind of seal down all those ducts before we then undergo the breast part of the mommy makeover, okay? All right. Okay, so you've made it through your clearance, all right? You've made it down here to Miami. Everyone's all excited. We talked to you at pre-op. Of course, at pre-op, we're gonna go over all your goals. You're gonna tell me about the breast. You're gonna tell me what's the look that you're going for. I'm gonna take certain measurements and combine those measurements with your goals to try to come up with the best plan for you, which can be, as like we said, any of these breast surgeries here. The tummy tuck part's typically more straightforward. We're gonna be removing all the excess skin. Inside, we're going to be doing that muscle repair where we kind of bring in the diastasis, and we're going to be strengthening the abdominal wall. And we also do liposuction along the flanks and the waist to give you more of that hourglass, more of that curvy figure. Okay, so that's going to be everything that we talk about during the pre-op. And of course, we're going to talk about your goals, your expectations, what to expect, and any potential complications, which we're going to get into here in a bit. Okay, great. So it's surgery day. Like I said, you're gonna come in and we are going to check the urine. We're gonna check your urine for any sort of drugs, anywhere from like cocaine to THC to methamphetamines to pretty much everything under the sun. We wanna make sure that it's all negative. The only one that we accept, and this is the only one, is the THC, okay? So if the THC is positive and the nicotine is negative, we're good to go. Now the THC is positive, the nicotine is positive, you're out, okay? So be careful, no bueno, no bueno. Remember, you have to be careful with how you take in the THC because sometimes some of those filters or paper wraps or whatnot, they have nicotine in them, okay? Unbeknownst to you. And then you're like, but Dr. Earle, I don't smoke cigarettes. And I'm sorry, but your urine says you have positive nicotine and we're gonna have to cancel and postpone your surgery, okay? So be very careful with that. Surgery will be under general anesthesia. That means you're going to be completely asleep, okay? And you're going to be with the little breathing tube during the surgery, okay? General anesthesia is very, very safe, okay? We have some of the best trained and most experienced CRNAs here, and they provide great general anesthesia in a very, very safe manner. I've trusted them to all our staff members, even family members, is how much I trust them. They're really, really good, okay? The surgery typically takes anywhere between maybe 2 hours if it's a straight breast dog tummy tuck, very quick. 2-3 hours if we're doing like a whole breast lift, new implants and the tummy tuck. And if we add that brachioplasty, it could be 3 hours and a half. So it really depends on the patient and how much we're doing. Okay, so anywhere from 2 hours to 3.5 hours. But even that, like, we're very, very quick here. We're very, very efficient. We kind of pride ourselves on that. So we want to get you in and out. We want to keep you under general anesthesia for the shortest time possible. Okay, it will require drains for the tummy tuck aspect of it. Unless you're going with Dr. Uyghur, if he does drainless tummy tuck, then you can have no drains there. But if you're coming with me, I will use drains for your tummy tuck, okay? And you're gonna have 2 drains. They're gonna come out of either side of the incision there. And how long they're in really depends on how quickly you heal and how much fluid is coming out. So it will never be in there for more than 3 weeks, but it's rare that they're in there for that long. For most patients, the first drain comes out somewhere around post-op day 5, and the second drain comes out just maybe 2 or 3 days later, okay? All right, but there will be drains for the tummy tuck aspect of it. One of the things that I highly, highly recommend for surgery day is the use of Earle. Earle is a medication that we inject at the time to decrease pain, and most people don't like pain. I would say probably 99% of people don't like pain. All right, so definitely highly recommend the Earle. I'll recommend it for everyone undergoing the Mommy Makeover. It's gonna make your life a lot better, okay? Because the Earle lasts up to 72 hours. So you're gonna have much less pain for the first 72 hours. Now, listen to what I said, much less pain, not zero pain. There is nothing that's gonna make pain go away completely, all right? And as you know, no pain, no gain. So there's gonna be some degree of pain. But with the Earle, it's gonna be super tolerable. Actually, most of our patients that have the Earle, they only take Tylenol, and they never have to take the narcotics or the Percocet or anything like that. All right, so definitely recommend Earle for this procedure, okay? All right, what about the incisions? Well, for the tummy tuck, as you know, you're gonna have an incision that's kept quite low, but it's in a nice gentle curve from hip to hip, and it's gonna be very easy to hide in your underwear or swimsuit. But you're also gonna have a little scar around the belly button. I try to tuck those in as nicely as possible so it's not very, very visible, to try to create the most natural looking belly button that we can, okay? The incisions for the breast really depends on what you're doing. So it depends on whether it's a breast dog, a breast lift, how much of a lift. So that can vary. It can be anywhere from a little tiny, 2 to 3 centimeter breast dog incision to that full anchor type pattern, depending on what you need, okay? All right, but you had surgery day. After you had surgery, you're gonna wake up from anesthesia, you're gonna come to a recovery room, and you're gonna be there for at least an hour, okay? But once you're ready, more awake, then we'll call your caregiver to come pick you up. So this is an outpatient surgery, meaning you do go home the same day, okay? Now you're gonna be in recovery here for at least an hour, but you're not gonna remember the whole hour. For the first kind of at least 30 minutes or so, you're awake, but you're still kind of sleepy and you're kind of out of it because of the anesthesia. So you may remember like the last 20 minutes or so, but that's okay. We always make sure that everyone is completely safe before leaving the recovery area and being picked up by your caregiver, okay? That involves a list of multiple checklists. We check all the vitals, we check the heart rate, the blood pressure, okay? We check your oxygenation, okay? We check everything to make sure everything looks good. Right before you go, we check on all the incisions and make sure everything looks great before you go, all right? We have a complete checklist there. We go over every single thing. All right, so then you made it home. We'll do a virtual, the post-op day 1, and we'll see you here in person on post-op day 5 to make sure everything's going okay and see how your drains are doing, okay? All right, so what about garments? For the breast, we're gonna give you a surgical bra. You're gonna use that for the first week, and then after that, you're gonna switch to your sports bra. A sports bra, no underwires, and you want one that opens and closes in the front. That's gonna be a lot easier for you, okay? For the tummy part of it, we're gonna start you off with an abdominal binder. It's kind of this white thing that wraps around you, and you're gonna have that while the drains are in place. Here's the key thing with the abdominal binder. Don't crank it. It is not a waist trainer. Don't think of it like a waist trainer. It's supposed to be there just to give you some support, but you don't want to crank it down. You don't want to affect the blood supply of these newly created incisions and everything that needs to heal, right? In order for things to heal, you need blood supply to bring nutrients and oxygenation to the area. So if you put that binder on way too tight, it can lead to problems such as skin necrosis, skin dying, basically. You don't want that. You just want it to be snug, but not too tight, okay? Now, once both drains come out, then you can switch from that binder to your garment, your faja, and that's can give you some more compression at that point in time, and that'll be okay. All right? So that's your garment. The next thing is your drains. Like I said, you're gonna have 2 of them for the tummy tuck, and we're gonna teach you how to take care of them, okay? Which basically means you just have to empty them out, and you have to learn how to charge them, okay? Walking, extremely important. We want to walk at least 10 minutes every hour while awake, because we want to minimize the risk of blood clots, okay? Walking is so important to minimize risk of blood clots. You can't just be laying around all day. That's dangerous, actually, okay? So the expectation is that you walk at least 10 minutes every hour while awake, and when you're sleeping or not being very active, and if you're going on a plane, you definitely need your Vena Pros. This is a device that we're gonna give you. We give it to all our Mommy Makeover patients. It's a device that goes around the leg there, and it keeps the circulation moving to also decrease the risk of blood clots, okay? I prefer to use this as opposed to the injection blood thinners. Studies have shown that this device is just as effective as the injection blood the injection blood thinners, as long as you're using it the way you're supposed to, all right? But of course, it doesn't have the side effect of bleeding. That's the downside to blood thinners, is that you may bleed and have a hematoma or some other issue. So we're gonna give everyone that Vena Pro device, super important. The way that you sleep, you have to sleep either in a recliner or your back up with a couple pillows behind your back, a few underneath your knees, okay? So you're relieving some of the tension in that belly area. And initially you're gonna walk a little hunched over like this, okay? And that's gonna kill your lower back, I know. One of the things in the first week, a lot of people complain of lower back pain because they're walking there all the time like this, and that's where the massages come in. So when you have your initial massages after your Mommy Makeover, they're gonna massage the areas where we did the lipo, and they're gonna massage your lower back to relieve some of that, some of the muscle tension in that lower back area, okay? They're not going to massage the central belly area in the first 2 weeks, right? Once again, you have big incisions that are trying to heal. So they're gonna massage flanks, massage lower back. After 2 weeks, you can start getting some massage in the front belly area, okay? The one thing that I didn't talk about here for a little bit later in the recovery is the belly button. So if you are gonna require some belly button training, you wanna do that starting at 2 weeks post-op. 2 weeks post-op for belly button training. And I like the ones that are like a sphere. So either like a marble, or Silogen has a nice one which is kind of like a sphere. I don't like so much the ones that are more like a plug. Those tend to cause some more irritation in the skin and potentially cause the incision to open. Okay? All right. And then the next thing, what about your incisions? So we're gonna cover the incisions with a surgical tape for the first 2 weeks. After that, you're gonna remove that surgical tape, and then you're gonna start your scar cream. The one that we recommend here is called Silogen. It's very, very good. You're gonna use that twice a day for the first 3 months. Got it? Got it. Okay, so we've talked about the good, right? The good is you're gonna get this beautiful Mommy Makeover. You're gonna look fantastic. All right, what is the potential bad? So we always have to talk about potential complications, right? The only way to have a 0% complication rate is to not do surgery, okay? Everything in life carries risk, including surgery. You carry risk just getting into your car and driving to work every morning, right? So what are the possible complications that we worry about? Well, bleeding is always, a potential of bleeding or hematoma. It's a possibility. The chance of that is very, very low, typically less than 1%. Okay? Actually, the blood loss for Mommy Makeover is usually very, very low because everything is open and controlled under direct vision, as opposed to say Lipo 360, where you're not under direct vision and potentially blood loss can be a little bit higher. Okay? Scarring, there's always a possibility of a hypertrophic or a keloid scar, especially if you have the genetics that are prone to that. Okay? So that's why we have to be super diligent starting in 2 weeks with that Silogen. And if we see anything getting raised, we may hit you with a steroid shot called Kenalog. okay? The sooner you get on top of scarring, the less chance you're gonna have like a very raised or very ugly scar, okay? All right, and then anytime we put in an implant, we can get all the potential issues with an implant. The one most commonly being a capsular contracture. That's when that wall around the implant becomes thickened and squeezes the implant, and it may shift its shape and become kind of hardened and stiff. So that's always a possibility. If you have a capsular contracture, we try to treat it initially with a medication called singular and massage. Sometimes with some external kind of RF energy can help as well. And a lot of times we can kind of prevent it, or at least prevent it from getting any worse. But if it does get worse, then sometimes you do have to go back to surgery. You have to either remove or release the capsule and exchange your implant. Okay? And then wounds are a possibility, okay? Especially if you are a smoker, you're diabetic, and your blood sugars are not well controlled. That's another big reason why wounds may potentially open up. Or if you get an infection, right? I forgot to write it here. Infection is another one that we worry about. Okay, so an infected wound can open up. The rate for infection for this procedure is actually also very, very low, less than 2%, okay, but it's not 0. Let's see, trivia. Who knows what is the #1 cause for an infection in a Mommy Makeover, which is specifically more in the tummy tuck part of it? If you all have been following me at all, you all know the answer to this. Anyone? Anyone?
Hey, let's wait.
Let's see. All right. What is the #1 cause for infection in a Mommy Makeover? And when I ask you that question, think about the tummy tuck part of it. Okay? As you think about that, I'll move on. All right, so wounds, if they do happen, then we have to take care of them, right? And typically we treat them with antibiotic ointments and dressing changes, okay?
We have answers.
We have answers? All right,
yes.
All right, let's see. What do you got?
Well, straight to the right answer. Well, we have here belly button.
All right.
Not cleaning your belly button.
Yes.
Hygiene.
Okay, that's part of it.
The recovery process.
Okay.
Belly button.
Nice. So we got some people that have been paying attention. Yes. Congratulations to all of you. That is exactly right. I'm so glad to hear that you guys know this already, which is great. So awesome. Strong work. The #1 reason is a dirty belly button. I don't get it, guys. Why doesn't everyone clean their belly button? When you hop in the shower, just get in there. Get everything out, okay? I can't tell you how many times we've had patients here where we're like literally digging out lint and rocks and just nastiness from the belly button, okay? It's not cool, guys. It's not cool. All right? So the '1 reason is a dirty belly button. For some reason, people don't like cleaning it in the shower. All right? Whether it makes you feel weird or not, if you're gonna have a tummy tuck or a Mommy Makeover, make sure you get in there and you really clean out that belly button, okay, to minimize your risk of infection. All right, but this is the one. This is the one that we worry about the most. Okay, this is the one, which is your blood clots, your DVTs and PEs. Okay, the rate of this is low. It's less than 1%. But if it happens, it could be devastating, meaning it could put you in the hospital, in the ICU, or even death. Okay? So when I talk about walking, and in the VenaPro, you have to do that. Okay? It is super serious. You have to walk your 10 minutes every hour. You have to make sure you have your VenaPro on and working at all times. Okay? You cannot leave here before 5 days after surgery, especially like on a plane or a long car drive. Okay? Multiple studies have shown that if you get on a long plane ride over 3 hours, or any plane ride really, or if you get in the car ride over 3 hours, right after general anesthesia and a relatively big surgery like this, the rate of blood clots is very, very high. After 5 days, that rate is low enough that it's okay for you to go. So you're coming here out of town for your Mommy Makeover, you're gonna plan to stay here up until post-op day 5. Okay, whether you're on a plane, any plane, or whether you have a car ride that is 3 hours or longer. So all our Orlando patients, you're gonna be asked to stay here until post-op day 5 in Miami. All our patients coming in from Tampa. So even though you're within Florida, you know, it's a long ride. I don't want you taking that ride. Jacksonville. When you're going to Jacksonville, you're staying here up until post-op day 5. Super important. Okay, guys? Because that is the one, that is the scary one here. Okay, your DVTs and your PEs. Woo! All right, I've talked a lot. All right, so
class.
I think this was, like I said, as promised, a comprehensive review of Mommy Makeover. But I'm sure there's always questions, and I don't want to leave without answering quite a few of these, so let's get to it.
Okay, we have a lot of questions. How soon can I get on plane after surgery and sit?
That's right. So exactly. So what, and you know, Mommy Makeover or any surgery that we do in the general anesthesia, so your lipo 360, your BBL as well, you want to stay here for at least 5 days after surgery. So you can't leave up until post-op day 5. Okay.
What do you clean the belly button with?
Great question. So before surgery, you should clean it in the shower with antibacterial soap. We have all our patients use a special soap called HibaCleanse for 1 week before surgery. And when you get in that shower with that HibaCleanse, you want to make sure that HibaCleanse gets all the way in there, all the way deep to the bottom of that belly button. Okay. And if you feel like, you know, some patients have very, very deep belly buttons, and I can understand in those cases that it's tough to get there. Use a Q-tip, grab a Q-tip, dip it in that HibaCleanse, get all the way in there and really try to clean it out and get everything out of there, okay? Now after surgery, what's gonna happen is you're gonna clean the deep part of the belly button with a Q-tip with hydrogen peroxide. So you're gonna dip the Q-tip into the hydrogen peroxide, clean the deep aspect of the belly button with that, and then you're gonna put the antibiotic ointment, typically the mupirocin, around the incision. The hydrogen peroxide, you should only do that for about the first 5 days or so. After that, you can quit the hydrogen peroxide because the skin might start to get irritated, but continue with the antibiotic ointment around the incision.
Okay, what's your BMI limit?
All right, so my max BMI limit is 30, okay? So we do have a max BMI limit for, that's my max BMI limit for my makeover, but for really any of my surgeries. For my makeover, there's not really a minimum BMI, but of course you have to be healthy, right? You can't be like completely, you know, unhealthy without any nutrients.
Okay, YouTube's on fire, Doc. We are live on YouTube too.
YouTube's on fire today?
Yes, sir.
All right.
Hello, Doc.
Hey.
After you do the plication for a tummy tuck, do
Yes.
the stitches dissolve? What happens to the... Wait. It's a long question.
Oh, okay. Go for
What
it.
happens to the stitches, and when you pull the stomach down, would that lower the breast or no?
Okay, so great questions. So first of all, what type of stitches are used for the plication depends on the surgeon, and there are some surgeons that use a permanent stitch, meaning that it never dissolves. However, I use a stitch, it's called a PDS if you want to kind of look into it, but it's a stitch that will eventually dissolve, but it takes a long time to do so. Sometimes 3 months, sometimes longer. It's a very, very strong, very thick stitch. It's called a 0 or number 1 loop PDS. And so we're going to use that to bring the muscles together and really strengthen that abdominal wall. But eventually, after everything's scarred down, that stitch will dissolve, and then you're good to go. The second part of the question was, if you do a tummy tuck, does it pull your breast down? It doesn't really pull your breast down because we're not, when we do the tummy tuck and we dissect up to here, but in the triangle type fashion, and we're not really kind of loosening everything here just beneath the breast overlying the ribs. So this stays adhered, so you're not really pulling down on the breast, you're just pulling down on the tummy part of it itself.
Dr. Earle, I lost 40 pounds and I carry most of my weight in my thighs. My BMI is 31 and I'm scared I won't get to 30 before surgery. What can I do?
So the good news is that you're close enough. If you have to get to 30 and you're at 31, I'm sure you probably don't have to lose many more pounds. It really depends on your height as well. But continue basically with your nutrition plan, and I'm sure you'll get there. My max BMI is 30, and then that's what we want to shoot for. But say if you get here and you're like 30.2, all right, I'm not gonna cancel you because of that. But if you do get here, if you're at 34, then you get canceled. All right.
Do you use mesh in your breast lift augmentation?
So not routinely. So we can use it. So the mesh, I like to use the one that's called Galaflex, and a lot of people refer to that as the internal bra. I typically don't use it for what I call a primary case, meaning the first time we're ever doing a breast procedure on this patient, because it's super expensive and I don't think all patients need that. However, if it's a secondary procedure, meaning the patient's coming back because they've either had a capsular contracture, they've had a bottoming out, or some sort of other issue, then I will consider using a mesh.
Okay. When the doctor does the muscle tie, can it untie due to coughing?
Yeah, so you have to be very careful, okay? So we do a lot of work with that muscle plication and we make things pretty tight, but it's then your job to take care of it. And anything that can increase intra-abdominal pressure can potentially rip those sutures apart, and basically everything becomes all separated once again, okay? What are things that cause intra-abdominal pressure? Coughing is one, like you said. If you're constipated, that's not good. You're putting a lot of pressure, right? Not good. So constipation is bad, sneezing is bad, coughing is bad. And the other one, which I forgot to mention here in recovery, lifting heavy things, right? So for the first 6 weeks, there's no heavy lifting and no strenuous activity for that same reason, okay? You don't want to be putting excess intra-abdominal pressure and busting open that plication. All right, we got it? Okay, everybody, I know I did most of the talking this time, but I think this was quite comprehensive. Pretty much everything you needed to know about a mommy makeover. Okay, so stay tuned. I'm gonna do a little series of like these comprehensive talks. I think the next one's probably gonna be BBL. All right, so make sure you tune in, and I look forward to seeing everyone next week on Hump Day with Dr. Alex Earle. Ciao.
Okay.